growth is important, but you have to get the correct measurements. So it's obviously daily weights, if the baby is stable enough to have a daily weight. I think a real challenge for a bedside nurse with the sickest, smallest preemies that are receiving Prolacta's exclusive human milk diet is that they're not always very stable, and they have lots of equipment attached to them, and it might be a very challenging procedure just to weigh a baby and to measure them, their length and their head. So if they can realize that I need to know what yesterday's measurements were so that I know if I'm having an erroneous number, that it should be always more than a one-person procedure. The respiratory therapist or a second nurse or a parent needs to be there to help protect the very precious equipment that their airway or their central lines, but also to address the needs of the baby so that it's not such a traumatic experience. And on the topic of length, I like to avoid the accordion effect, I call it. Babies don't usually shrink in the NICU, and so I think it is a technique that can be perfected, and that's why a two-person technique is really important, to ensure that the baby is manipulated in a way that maximizes their length and that their length isn't going up and down week to week. It can be a real challenge.
So we utilize length boards. There's a lot of training that goes into actually using them and getting them, and we have different sizes based on the gestational age of the baby. But interestingly enough, the other thing that we do is that we do daily weights, and based on diagnoses and obviously fluid restrictions and different things that babies need, we actually only use working weight or change working weight once a week, and won't change their feeding protocol based on a daily change. And so that is actually really helpful when it comes to sticking with a protocol and making sure that we're following and not just reacting for the day-to-day weights that we're doing.
Well, and I think that we too use length boards. We haven't for very long. And part of the challenge was understanding why that length was so important. I think nursing, you look at the weight, but the dietitians were always fussing because the lengths would go up a centimeter, down a centimeter. And so we did a lot of education about why that length is just as important. So.
Well, we know length is a very close indicator of long-term neurodevelopmental follow-up and outcome. So length is an important one. And you only get it once a week. You want to make sure it's the right number.
And the other thing that we also discuss on a daily basis in rounds is Z-scores, and making sure that everybody is within where they need to be. So I know that that's another piece.